Hey everyone, and welcome to the Conversation Starter podcast, part of Connect the Dots campaign, connecting communities one conversation at a time. My name is Shirley Blanche, and I'm one half of the Conversation Starter project, along with the lovely psychologist Dr. Tara Quinn. And through our volunteer-led CIC, we offer both free and paid community wellbeing services in West Sussex. And today, we're really delighted to be joined by the wonderful Hayley Dower and Amelia Lewis from Age UK. Welcome to the Conversation Starter podcast.
Hi, thank you for having us.
Hello.
It's so great to have both of you here because you've got kind of different roles within Age UK and they've got very sort of distinct areas, but you work very closely together, don't you? So Hayley, if we start with you first of all, what's your role within Age UK and how do you use that role within the community?
Yeah, of course. So thanks again for having us. So I work as a senior community developer. So within my role, I cover the Horsham district and really want to tackle social isolation for anyone over the age of 50 living in the district. I've got such a passion and, really want to try and help as many older people as we possibly can. So we work really closely with all of the other services that Age UK offer, including Amelia. That's why I wanted to bring her along today, because our roles really overlap and kind of complement each other. And a lot of people don't realise about social prescribing and us having it. So really looking forward to hearing from Amelia as well. But we obviously work out in the community. So we want to go out and meet as many older people as we can. And we do it in so many different ways. We literally, anywhere that will have us, we will go. We like to go out to supermarkets. We like to go into sheltered accommodations. We like to come out and join walks like yourselves, or, even connect with, groups in the community. We go to the libraries, anywhere that will have us, just to kind of get the word out there, to support anyone over 50 living in the district. So I'll tell you a little bit about the service and how it works. Would that be
brilliant?
Good?
Perfect.
Yeah, perfect. Okay, so the community agent service, which I look after, we support anyone over the age of 50. So it's anyone that may be living alone, feeling socially isolated, and just doesn't know really how to turn. People can ring our 0800 number, they can email in, and then we will link them up with Megan or our lovely new community agent, Elena. And it's kind of a short-term light touch service where Megan will kind of get to know what they want, what are the barriers that are stopping them from socialising. Is it confidence? Is it financial? Is it disability? She'll really kind of get to know in that initial call or meet up, what it is that they need to support them. And she'll work with them. She'll go through different groups that are available, because as we know, there's so many amazing groups in the district. It's just kind of linking up, whether it's the transport, getting them where they need to be. And we've had some really great kind of successful stories, people that have been living quite rurally, especially sort of Billingshurst, West Chiltington, some of the real rural kind of areas where people can feel kind of isolated and stuck because of more where they're living, or it even could be digital. We've got the amazing computer clubs, Henfield, Southwater, so just linking them up with things that are there. And just helping them really. We obviously have groups that Age UK run. So we obviously have Lavinia House here, where we have dementia daybreak services, as well as seated exercises and chatty crochets. But we know everybody might not want to come here. So we have a men's group, which, we're always welcoming new members to. That meets at the Coop Pub at the bottom of Merryfield Drive. That meets once a month, and I believe at last count there's about 17 members. They all have a chat. I think it's £2. You put £2 in the little pot, and then you get unlimited tea and coffee and a biscuit thrown in as well. And it's that community pub setting that have really welcomed us and made that group last. And now the group really sort of own it. They arrange days out. They're going next week, hopefully, if it's not too hot. They're going to the Southland Downland Museum? They've also been before to Amberley Museum, and we also had quite a fun trip to a brewery as well. So they really take ownership. But yeah, we're really lucky with the support of the community group. So that's kind of the community agent service in a nutshell, really. But yeah, like I said, we work with all our other services, our information advice service, our dementia and extra care service, as well as our hospital services. Really, once somebody gets referred into Age UK, we can kind of refer them, to whatever service best suits their needs, really, whether that's possibly Amelia's service as well.
So that's really interesting. There's quite a lot you covered there. First of all, if someone's listening to this and they're in the area, what sort of area do you cover from where you are? So you cover Horsham area, but you mentioned Billingshurst, West Chiltington.
The
So
whole of the
is it
Horsham district,
so
anywhere in the Horsham district.
anything that's classed as Horsham district, you
Yeah.
cover? I found it kind of interesting that you were saying anyone over the age of 50, because my preconception, again, and this is why we've done this podcast really, is to sort of break down some of the preconceptions we have around different organisations out there. I was thinking it was sort of for people probably age 65 and over. So again, that's really interesting that you're talking about that demographic, which I wouldn't have necessarily thought would be able to use your services. So that's one of the reasons we really wanted to do this podcast, was to sort of tap into the faces behind these organisations and really understand what it is that you do to make it more accessible for people. So I love that. And like you said, this is what Tara and I always say, is there's so many amazing groups out there. We're really lucky in the area, I think, that we live in, because there's so many people proactively doing things. But we don't know all of the things that are going on. It's really hard to do that. So I love that signposting element. I think that's really great, and engaging people in that. And it sounds like there's some great projects out there. So just coming to you then, Amelia, from what Hayley said, what's your role, and how does your role differ to what she does in the Age UK setup?
Yeah, so yeah, thank you for inviting me on to talk a bit about social prescribing. So I'm Amelia, I'm the senior social prescriber in Age UK. So I manage the team in Horsham and Mid Sussex, and I hold a caseload myself, a small caseload of more complex cases that might come to us. Because like Hayley was saying, there is some overlap between sort of community agents and what social prescribing can do. We have a strong focus on loneliness and social isolation, with supporting people if they're wanting to get out and about, but there's other elements to social prescribing that we cover. So ultimately, sort of the ethos, I suppose, is that social prescribing is a non-medical intervention that can support with quite a large range of different issues that might be impacting someone's health and well-being. So it might be housing, it might be finances, it might be social isolation and loneliness, where it's having that knock-on effect. And it's an intervention that we can do short term. We offer up to 6 sessions. So it's all about goal setting and working towards that goal that somebody sets. It's a very person-centered approach. So the way that we work is we work with what matters most to you, and what it is that they are wanting to achieve. And we will work with them to be able to form a sort of a community or social network around them to be able to achieve the goal that might be set. So it is quite a lot of different things that it might be. It might be that someone's wanting to join a local group, get out and about a bit more, or it might be that they're in sort of debt with their rent, and perhaps there's some housing issues and the knock-on effect that does have. And I think it's really interesting also what you picked up on in terms of, with obviously Hayley's service being 50 plus, and there's sort of this conception of Age UK sort of being for older people. But I mean, in social prescribing, so we can see people 18 plus. So we're a community-based service. We mainly operate remotely because we sit within the community rather than with a specific GP practice. But anyone that's 18 plus can come to us, even though we're Age UK. So, and that's not often always known, because why would it be? Because it's Age UK. But it's good for people to know that if you're wanting to, you're not knowing where to start, maybe something's going on that's impacting either mental, physical health, or just general well-being. It's a good starting place to be able to organise what it might be that someone wants to work towards, and what really is your priorities that you want to focus on. And we can work with that person. So we work within the community. We can take referrals from anywhere, exactly the same patch as Hayley, so that the Horsham district can refer in. You can be referred in via your GP if you want to come in that way, or you can ring our 0800 number and be referred into a social prescriber. And can come to us. Our team, the kind of model that operates is we sit within the proactive care teams of the PCNs, so the primary care networks across Horsham. So we work with the highest and ongoing needs projects that are going on within the integrated community teams. So anyone that's being referred into there, we can sit in and we can sort of offer that more social element that might be supporting somebody, because it might be someone that's had a recent fall, they've got multiple different medical needs, and we want to make sure that that social bit isn't neglected and we're still getting in on that, because it might be that if they've had a stay in hospital and just come home and they haven't left the house in 6 weeks, they might need that little bit of extra support of knowing where to start, and that's where we can come in. So it's a very holistic model that works really well, in my opinion.
I think that's great. We've worked with social prescribers, haven't we, Tara, in the project? We've had people being prescribed our project, and one of the things that I think is challenging is that a lot of these things are changing all the time. The structure of these things are changing. So it's actually being able to signpost people effectively to be able to access social prescribers, because it seems to be changing. I don't know if that's down to funding or the way that the structure is. So people can actually contact Age UK at any age to access social prescribing through Age UK.
Yep, as long as they're over 18, so adult.
Over 18.
There's no other eligibility criteria, so you don't need to be in any particular distress or anything. You can just come through to us, because the idea is it's a proactive, preventative approach. So people can call through and we can support.
That's great, because that's so what we're about in the project as well. It's about empowering people over their own health and well-being, and that's why we love working with social prescribers. And I've got to say, and I don't know if you knew, Tara, but I didn't know you could access social prescribing through Age UK.
I didn't know.
So again, this is why we've done this podcast, so that it's educating people about all the services out there, because it is hard to know sometimes the routes to go through to actually get that. So presumably then, when your roles overlap more, because Hayley, you're working with people 50 plus, so you wouldn't necessarily get involved in the areas where people are under the age of 50. So where your two roles overlap and you work together is in the 50 plus range.
Yeah, and I think also sometimes as well, it might be a slightly more complex client. So we might be able to initially help with the first stages of the social isolation, and then we've got the lovely opportunity to refer into Amelia's social prescribers if the client needs, maybe a few wellbeing sessions, or around the frailty that Amelia's team can kind of pick up, really. So they complement each other sort of really, really well. We do so much crossover working. It's great. And I think again as well, the really good thing is that people don't know about us is we are actually an independent local charity. Everybody thinks we're, we obviously work under the umbrella of Age UK, but we're actually an independent charity in our own right. Age UK West Sussex, Brighton and Hove, and so many people don't kind of get the gist of the two being separate, but that's how we know our areas so well that we work in, because we get to focus specifically and learn what's going on there.
I must say, I don't think I knew that either. Did you, Tara?
I knew it was standalone, but I was just thinking about the positives of that in terms of autonomy and being able to be more innovative, I guess. In terms of what you do then. I hadn't thought of it that way.
So I think that's brilliant. So you've got this whole area covered, and so you're mainly Horsham District, and you're both Horsham District, is that right?
Yeah,
okay,
correct.
All right, just got to get it, because it gets complicated, doesn't it? It gets complicated, all these structures and these areas and things like that. And so really, if somebody's listening to this now and they're thinking, well, maybe I want to access the services either for myself or for a relative, what would you say is the best point to kind of start with? Is it just the free phone number? Is that the best port of call, and then someone will assess what their needs are by accessing that number?
Yeah, so they can ring into the 0800 number and speak to one of the team there, who can triage the call. If not, I'd always say, if you use the internet, have a look at our website. It tells you all the different services, including Amelia's, all the services that we offer and all the different sort of criteria for them are all listed very clearly on there. I'll also send over the link for our Horsham locality Facebook page. That's really good to find out what we're doing locally and what's going on as well within the centres and within the community. So they're really good resources to look at as well.
That's amazing. So, Tara, from a sort of a psychological perspective, having that support around loneliness and isolation, and having one organisation that covers all those different branches, because what I think is so interesting is that Amelia was talking about not just what we would consider mental health or physical health, but it's all those other social aspects which impact each of those areas as well. It's really good to have this kind of integrated approach, isn't it?
It is. I was going to ask actually whether, so people may be listening either for themselves or maybe signposting a relative. And again, I think we've talked about this a lot in a few podcasts lately. There can be a lot of preconceived ideas about what services are, and there can also sometimes be a bit of stigma and shame about accessing services, especially ones where it's around emotional health as well, or vulnerability. What are the kind of barriers that you see? What stops people reaching out from the work that you both do? Because I think that's something really important to cover.
I think for my service, it's probably a lot of digital exclusion as well as people are getting older. And you also find a lot of people move into the area to be closer to their families. So they haven't actually lived in the district for that many years, and they're kind of sort of maybe slightly older and starting from scratch again. So, and it is building up that confidence. I know what it's like when I go to like a new exercise class or something. It's having that confidence, isn't it, for the first time, just to walk in the door, all the unknowns, especially if you don't know the area specifically. And again, financial, I'd say, wouldn't you, Amelia, with, you know, the cost of living crisis, which is continuing, that can be a big barrier as well.
Yeah, I think a lot of what we see is very similar to Hayley, and it's the confidence, but not just the confidence. I think it's this sort of perception that we have where sometimes it's quite hard to ask for help or knowing when you are in need of help, because the way that it's been shifting is it's almost like sometimes it feels like you need to be in a crisis point to really be eligible, or like you can go and get some support. And it's about raising that awareness of sort of our roles, and the reason we're here is to try and intervene before you get to that point, because it's not fair on them, it's not fair on anyone. And so being able to have that confidence to be able to be like, actually, I'm not feeling quite okay at the moment, let's sort of see what we can do now. And that can be hard, because I think there's also, especially because we're an NHS commissioned service, which goes back to the point you're making about how like it seems to change a lot. And I think anything that comes under NHS and with restructures, like, you know, we try and keep it as simple as we can. And I think sometimes with those services, people feel like they don't want to waste time. Like, you know, I hear it a lot where it's like, oh, my appointment could go to somebody else more in need, which just isn't the case, because that's what we're here for. And we're here for people to be able to seek out help. And that's the kind of message that we want to send.
I'm so glad you said that, because I think there is a lot of kind of, you know, a lot of really goodwill there. I'm maybe not in a point where I need it or someone else can need it, but it's the fact you're very similar to Shirley and I in the way that we run our project, that we're not kind of crisis driven or reactive in terms of support. We're trying to empower people over their health and well-being, and that can be emotional health, physical health, vulnerability, whatever that is. So I think that's really important for people to know. So actually, you know, technically somebody who's 50 plus, if we're taking kind of the work you do, Hayley, who's noticing, and it really is that simple then, something's just not right, I'm lonely, I'm isolated, or I'm struggling, you can start that work whenever, rather than waiting for things to get to crisis point. And that's obviously, for a lot of people, it's a harder time to intervene as well. And I think actually that I've learned a lot today just about that, in terms of it's actually a very preventative model. And I don't know, do you kind of come across that, I guess, again, that kind of preconception that people may have about Age UK, that it's more vulnerable older people who may be in crisis, you know, they've lost someone or they've had a fall? Do you find that you have to kind of tell people the kind of new narrative of the work that you do?
Yeah, I'd say the biggest thing we get, I get, is I'm not old enough for Age UK.
Yes.
I was going to say, no one's ever old enough for Age UK.
You know, we had a one lady, bless her, who was 95. I'm not old enough for Age UK, you know, and it's like, over 50, we can help you, honestly, you know. And I think that, again, is our important work of our outreach, you know, into the community, you know, to really kind of raise awareness, you know, that we can help people, you know, before they get to crisis point, empowering them with the information that they need to make, you know, positive change. That's what we really want to do.
And do you find that that model has better kind of impact on motivation and re-engagement in things, so rather than kind of a crisis-driven model?
Yeah, I'd say, yeah, obviously it totally depends on each individual sort of, you know, customer that we help. But, you know, most people are really engaging. I think once they find the source of information, it's kind of a straight road. Would you say the same, Amelia?
I'm so sorry, it just cut out when you asked your question. Sorry, would you be able to just repeat what you said?
I was just saying, in terms of you, rather than kind of going for a crisis model, that kind of preventative model, do you find that that makes people kind of more motivated or more easily engaged in that process in the longer term?
Oh, absolutely. Yeah. And I think it's exactly what we've been saying about empowerment and having that confidence to take ownership of your sort of health and well-being. And, you know, the evidence shows that if people themselves make that choice to engage as well, there's often a lot higher chance of engagement for that person, because in social prescribing we use sort of motivational interviewing and behavior change techniques, so that's what they're sort of experts in, and so being able to utilize that, you still need to be in a position where you can make change. So you want to have that preventative proactiveness, because of course if somebody is in crisis mode, the last thing you can be doing is thinking about how to make change. You just can't do it, and it's causes more upset at that point than if you were to be able to intervene at an earlier time. So absolutely, it encourages engagement.
Maybe people that are listening to this going, I really like the sound of that, the kind of preventive thing that I can act now. So someone could be, you know, early 50s, noticing maybe some lower mood, not so engaged, or just moved to a new area. But they may go, what does it look like? The difference, isn't there, between phoning up and starting that journey and then brain kind of going, oh, what could that look like? So from a social prescribing point of view, for example, if we're thinking to someone maybe kind of more the demographic maybe we'd have on our walk and talks, which is predominantly kind of over 50, what could that look like? So if someone's kind of, let's take loneliness, isolation, maybe a bit of lowered mood that might come with that, what could that look like? What kind of things could you signpost them to, in terms of like a pathway?
Yeah, we would always start, so we'd make an appointment, and just start off with a chat and do a bit of exploration about what it is that's going on at the moment. You know, are there any particular worries that might be going on, and what are your priorities of what you're wanting to do? So it's that what matters to me approach. So it's very sort of, you know, informal to in a sense, because sometimes it can be quite scary and quite intimidating, like thinking you're going to be talking for 45 minutes, which when you do start talking you realize actually 45 minutes isn't very long. But in that initial appointment, it allows that social prescriber where even if you come to the appointment and have no idea what it was that you were going to be wanting to focus on, through talking about what's going on, that social prescriber is going to be able to pick out and just organize those thoughts a little bit and sort of hear what you're saying, and then reflecting back and perhaps putting a plan in place on what you want to do. And that's why it's so nice that we've got, you know, quite a few appointments with follow-up. You know, we have up to 6. It means that actually by the 2nd or 3rd, if perhaps it might look a little bit differently, that's still okay. So even if you're not too sure about what we do in the first session, you can go away, action what it is, that whatever what was set, you can come back to the 2nd appointment and we can delve a little bit further into how was that, how did it feel, what's working, what's not working. So it very much means that it might be that we might link you up, you know, there might be some local groups that you're interested in and maybe want to go out to them. It might be that, you know, you're looking for low cost counselling, but you don't know what low cost counselling is out there. And I think what also taps into that, the sort of ever-changing landscape, especially within the charity sector, you know, funding comes and goes, but a lot of local sort of organizations, they also come and go. So there might have been something a few years ago which somebody heard that their friend was interested in, but now it might not exist anymore. So what else could that be? And we're able to collate that information and give options, which is often always a good starting point for people just to know what's out there and just to go from there.
because that's the thing that strikes me, and we hear this sometimes from our walkers, that there can be, again, a bit of a kind of a preconception that it's just about signposting people to social groups, which may not be for everybody, and that there may be a barrier to accessing services. But I guess one of the things that I've learned today then is, we're looking at barriers to connection, barriers to kind of improving well-being, is that you can let them know a range of things that are out there. It's very person-centered, as you say, but I think actually then that's really nice for people to know that there's choice and autonomy and flexibility.
Like an example, a case study be helpful to
it's the pathway really for people of the types of things that there's, you can signpost to counselling as well as kind of social groups, and what other kinds of things I guess you can signpost people to, because sometimes just listening to a podcast and going, it could be this, it could be that, can just help people to make that call, or to go through your website to make that first contact.
An example I use, which is quite a nice way of being able to conceptualize it, because social prescribing, I think it's relatively new as well, and it's quite hard to really define exactly what it is and what we can help with. But we had somebody referred to us it was via their GP, because their asthma had been getting significantly worse, and there wasn't really much more from like a medical perspective that could really be done, in terms of inhalers and medication and whatever. Referred over to the social prescriber because they mentioned about their housing, and it didn't quite sound like the best environment, and it turns out that they had mold and damp in their housing. And so within their home, if the environment that they're living in is going to be impacting their breathing and is going to be exaggerating their asthma, no matter what the GP could do from a medical perspective, wouldn't be able to get to that core issue of the housing. So we were able to explore that and be able to help with linking into the council, the housing department, what it is that we needed to do, what the pathway was for them to be able to get this mold and damp fixed. And ultimately the council was able to go get it fixed, get that damp and mold sorted, which then had that positive impact on the physical health. So I think sometimes that connection isn't always clear, and so that's the sort of thing where it might be, and it's exactly what you're saying, it's not just sort of social groups that you might be linked up with. There might be something going on, and if there's something we can do to help, then we're going to help out.
That's really useful for us to know, just in terms of, because sometimes when we're running a walk and talk group, part of what we do is just safeguarding. So there may be things that people organically talk about on our walks, about their living situation and other things. So that's actually really useful for us to know that's something that social prescribing can help with as well. And I guess one of the things Shirley and I are really passionate about is collaboration between groups. That I'm thinking somebody who may be struggling with their health may then not have been going out if they're feeling really poorly and their asthma's not being good. Is that a barrier to them becoming confident about going out and losing contact? So then it's almost kind of like a spider web, isn't it, where you're kind of going in different areas with them and then signposting to other people. It's kind of very much what we do, isn't it? It's starting conversations, having conversations like this that then lead on to what that person means. But it sounds quite holistic as well, so I think that's something else I've taken away from today. It's kind of breaking down some barriers, and as you say, it's so interesting, isn't it? You realise how much kind of you have around that word Age UK, and I've learned more about what it is actually today, and I think that's really going to be actually really useful for people to hear in our district.
Definitely. And I love all. Sorry, yeah.
So I was just going to say, we're so lucky in the Horsham district with the other charities and people that operate. We are so lucky with where we can signpost to, because everybody is just so invested in helping and working together. Yes.
I think you're absolutely right. We found this, just through doing the work that we've done for the last 5 years, the amount of people who are really motivated. And, we're a volunteer-led organisation ourselves. And so there are so many other organisations out there doing so much great work, and there are so many volunteers in the community. And we seem to be in Horsham a very proactive community with people really wanting to help each other. So I think we're really grateful, and we're really lucky to have that. And also I love the social prescribing, because I think it's helping people to shift their mindset away from just being completely dependent on somebody outside of themselves, to understanding that making changes within their life, whether it's their home or their social environment, has that impact on their health and well-being. And I think that's a message that we try and get out, is there's so much more you can do for yourself than maybe you've believed that you can. That's why we work with MSK, don't we? You know, so it's all about, you know, people understanding that they can do all these things to help their own health and well-being. So it sounds like you're doing incredible work in the community, both of you, and we're really grateful to have you guys out there doing that. If people want to find out more about what you do, where you said before you think the website is the best, what's the link for the website? We'll put it in the description as well, but for anyone listening to this, if you could just share the website to go to, or the 0800 number.
Yeah, the 0800 numbers 0800 019 1310, and the email address is, it would just be, if you just type into Google, and I'll send you the link, Age UK West Sussex, Brighton and Hove, and it will take you straight to all of our services, and then you can filter it through the different areas, so you can select on the Horsham district, and it will bring up all of the services for the district that we offer.
That's absolutely brilliant. We're so grateful that you've taken the time to join us today to share all about your amazing services that you offer. I've learned loads. I don't know about you, Tara, but yeah. I think, like Tara says, we've learned as much about what you don't do as what you do, and it's blown some of our preconceptions. And so I think, hopefully for anybody listening out there, they've got a much clearer idea of who's behind Age UK and some of the services that they can offer. And we're just really grateful for you both joining us today.
And you're joining us on our walk, aren't you, in a couple of weeks' time, which will be lovely.
Yeah,
we'll get to see you.
Looking forward to
it. Maybe we'll do a little video to show people what it's like to collaborate.
So thanks so much for joining us today. Thanks so much for everybody listening. I hope that it's changed your perspective around Age UK, and you've realised that maybe there's some of their services that they could offer you that could help you or someone that you care about. So please do go and check out the amazing work they do. Thanks for listening. We hope to catch up with you again soon. In the meantime, do take care, and we'll see you soon. Bye-bye.